We were talking about some conservative treatments for arthritis in the knees. Now, obviously, sometimes in many cases, it's just not enough and it becomes unbearable. So what happens when that doesn't work? And I've seen it in my own family where they said, forget it, I'm never gonna have surgery. And then at that point, they say, just bring it on.
Well, you know, it's about quality of life. So if you cannot maintain your quality of life with conservative management and you've tried it all, then the last resort is knee replacement surgery. And, you know, patients get to that point where they're ready. They'll tell you, I'm ready. And then that's usually how it happens.
Right, because again, the quality of life, it's unbearable and they just can't deal with it anymore, right?
Yep.
Now, is the surgery, doctor, is this a good option for both types of arthritis or just for the osteo one that we talked about?
Yeah, you know, knee replacement is applicable to any kind of arthritis that destroys the joint, whether it's inflammatory arthritis, osteoarthritis, or post-traumatic arthritis. It's just replacing or resurfacing the joint that has been destroyed by any kind of arthritis.
Are you ever too old to get a knee replacement?
Well, you know, looking at age just independently, it's one thing, but you just got to look at the physiological age of the patient, because you can have an 80-year-old patient that is perfectly healthy, and you can have a 65-year-old patient that is physiologically 90. So age is one variable. What we do know is that the recovery of a knee replacement on patients above 80 years old is a little bit longer than younger patients that are stronger.
Is there someone that maybe could not be a candidate for knee replacement surgery?
Absolutely. Sometimes the patient's health, such as their heart, kidneys, or lungs, is not good enough, and the risk of surgery outweigh the benefits of surgery.